So to start our meeting today, we have Carica Health here, and Simon Liu will be speaking with us today. He is a respiratory therapist and a graduate of the University of Manitoba. He's worked in hospital and now focuses on community care, specializing in home care and sleep apnea therapy. With his free time, he likes to play competitive board games, and if the weather's nice, out driving on his motorcycle. So I'm thinking you have a couple more days of that. Anyways, welcome, Simon.
Thanks, Debbie.
I'm sorry, I forgot to mention, because I didn't write anything down today. The session, thanks to the generosity of CPFF, the session that Simon is doing with us today is going to be recorded. And then it's going to be put on the CPFF website and the Manitoba Lung website, and it's going to be used just for educational purposes, so anybody can access it and learn about home oxygen. So after Simon has finished his presentation, I will go around grabbing the questions from you, and I'll repeat the question, and then Simon will answer it.
Okay. Thanks, Debbie. Hopefully no pressure there.
No pressure.
So yes, my name is Simon Liu. I am a respiratory therapist at Carica Health. A little bit more background. I've been working in community care for, a little bit.
Hold the microphone closer.
A little bit louder? There. Okay. I know, I'm not used to using a microphone like this. But yeah, so I've been working as in community care for over 8 years, specializing in home oxygen and sleep apnea therapy. So a little bit of disclosure. I am employed by Carica Health. But in no way, shape, form has there any sponsorship or money for this presentation. So all information to you will be presented for educational purposes only. So our agenda today is going to be mostly focusing on, we'll kind of talk about a few things. Talk about what is oxygen, talk about different types of oxygen equipment available. I'll talk about the physiology effects associated with pulmonary fibrosis, and then also talk about qualifying for home oxygen in the Manitoba program. And also what is covered and what is not covered by them. So a very general overview about kind of everything, and then we'll have some time at the end for questions as well. There you go. I guess to start off with, what is oxygen? Very briefly, in a room temperature, oxygen is a colorless, odorless, and transparent gas. But at certain temperatures, it can be in the liquid form as well. It is non-flammable, but greatly increases the combustion of things. So what this means is that if something's on fire, if you introduce oxygen to it, it will usually burn a lot brighter and a lot faster. So one of the misconceptions that people have with oxygen is that they think that oxygen can blow up. Unfortunately, that is not true. It is essential for life, and is usually abbreviated by O2, as you can see over there. So when we talk about oxygen, one thing that people always kind of wondering is essentially what that is, or what we're breathing in the air. But actually what we're breathing in is not pure oxygen. It is actually a mixture, and we call that, in at least medical terminology, room air. It's composed of about 21% oxygen, 78% nitrogen, and about 1% is made of about argon, carbon dioxide, and other trace gases. So whenever you talk about room air, you're kind of thinking about 21% oxygen. Now, when we do use oxygen, we're looking about different purities of oxygen. I did list there's a lot of different grades of oxygen purity, but the main two that we're looking for is medical grade, that's about greater than 99% purity, and then also industrial grade, which is about 99.5%. I kind of put that there, it's more of a joke. So if you're ever running out of oxygen and you in a pinch, just find your nearest welder shop, and they got some of the good stuff there. Next part is going to talk about the different types of oxygen available. So there's three main types that you'll encounter. First one is going to be liquid oxygen, oxygen in oxygen cylinders or compressed gas, and then oxygen concentrators as well. So we'll first start with liquid oxygen. So liquid oxygen, this is the one you're really mostly associated and used at the hospital. They usually are transported in bulk to hospitals in large tanker trucks, and they're stored in these large cryogenic storage facilities, and we'll pair that with evaporators on the side. So next time you're at the hospital, take a look. You will actually see these around. I know at the health sciences, if you ever drive down Notre Dame and Pearl Street, see if you can find these. The main reason why hospitals use liquid oxygen is mostly for transportation and also for cost-wise. Liquid oxygen, when it evaporates into compressed gas, you do expand quite a bit. You can get from about 1 kilogram of liquid oxygen, you can get about 847 liters of pure oxygen from that. So from a logistics perspective, it is very efficient. It's also very cost effective too. Liquid oxygen is the most cheapest form of oxygen, so that's why we mostly see that used in the hospital. Now, unfortunately, we don't really see that too much in the community, mostly because with liquid oxygen, there's a lot of safety factors involved. So you have to be a little more cautious using it, but also that in liquid oxygen, it boils at about negative 183 degrees Celsius. So at room temperature, it's constantly evaporating to the air. And one of the downsides is if you don't use it, unfortunately, you do lose it. So that's why at least in the hospital, we're not really worried about wasting oxygen because we didn't even use it anyways, it's going to be gone. Next one is going to be compressed gas or oxygen in oxygen cylinders. So this is really the common form of portable oxygen that we see. They come in different sizes and shapes and weights. They can be made of steel or aluminum. And here I have a little picture here that shows the different sizes available and how most people carry it, either in a cart or if they can also carry it in a backpack as well. Now, the biggest downside with oxygen cylinders is they can be a bit bulky and a little bit more difficult to use. So there's a bit of training involved using oxygen cylinders. But once you get the hang of it, it's not too bad. But one of the biggest challenges we find is that people with low dexterity or people have arthritis in their hands, changing oxygen cylinders is a bit more difficult that way. And one of the things that we noticed is that with oxygen cylinders is that, unfortunately, depending on your oxygen flow rate, they might not provide enough time. But as a tried and true system, it works very well, at least for those purposes. Next, I'll talk about is oxygen concentrators. So this is kind of like the most common form of oxygen that you'll see, both at the home and also with small clinics. I have a picture here of a brand Respironics. It's the most common one you see in the community. And some people like to call it the blue machine, because it's blue. But yeah, you'll see these quite often. They're very cost effective, and they can make oxygen all the time. And the way it makes oxygen is by a different method. It uses what's called a molecular sieve beds, where it takes regular air in, absorbs all the nitrogen, and then leaves behind pure oxygen at the end. So for this type of oxygen, these machines can make up to 10 liters per minute. So a good amount of oxygen. They're designed to be used 24/7 and very low maintenance. So that's what at least we see employed in people's homes and even small clinics. We see a lot of veterinarians use these for their operations. So long as they're not using too much oxygen, this is a very cost-effective method. Now, another form of oxygen, and probably we'll see we have some people here using one of these already, is portable oxygen concentrators. So these are battery-operated machines. They work very similar to the home concentrator. They take regular air in, absorbs nitrogen, and it leaves out pure oxygen afterwards. Purity-wise, you can get about 96%. They're small, lightweight. Usually they vary from about 6 pounds to about 10 pounds. And they generally will provide more time than oxygen cylinders. With these ones, what's nice about them is that you can be plugged in and charging the battery as you use it. So that also gives more time that way as well. You can also plug it into the home, also in the vehicle as well. So if you ever want to drive to the beach, go right ahead. You can just plug into the vehicle, drive as long as you want, use the machine with the battery there, and when you come back, drive home safely. These machines are very low maintenance. Really, it's just cleaning the filters, usually once a week, and that's about it. Now, unfortunately, there is negatives to these systems, and the biggest negative with these is also the way it gives oxygen. Unfortunately, unlike oxygen concentrators or the oxygen cylinders, they provide oxygen using a different system called pulse or on demand. What this means is that the person has to breathe with their nose to trigger these devices, and then the machine gives the oxygen. So unfortunately, it doesn't work for everybody, especially if you breathe with your mouth. If you breathe your mouth, mainly breathe your mouth, these tend to struggle a bit. So we always emphasize breathing with the nose with these. Because of this different system, one thing that you unfortunately can't do is sleep with them. So as a all-in-one machine, these are not. But for ones that go out and come back home to either sleep without oxygen or with oxygen using the other machine, then these are very good. We find that when people are sleeping, they tend to breathe more with their mouth, and so with these on-demand pulse-activated devices, it doesn't work too well. We do have other machines that you can sleep with, and that's kind of why I put the picture of the brown machine. Now this picture is not to scale. That white machine is a lot smaller. I just kind of made it a little bigger to make it easier to see. Now, unfortunately, the biggest barrier to entry to these devices is the cost. Compared to oxygen cylinders, they do cost a bit more, so you do pay a bit premium for convenience. And we'll talk about cost and coverage at the end, but at least kind of tell you the pros and cons about these machines. So now that I've talked about what is oxygen, what is available, we want to talk about some of the physiological effects of oxygen. Main one is, why do we need oxygen? So unfortunately, oxygen is essential for life, so everything in our body relies on oxygen to function well. From processing energy, making energy, to thinking and everything. So especially our brains, heart, and lungs, they rely a lot on oxygen to function properly. And when you don't have that much oxygen in the system, then we run into trouble. The biggest trouble we find is that you start feeling symptoms, and then all of you might experience some of these or not, or a combination. And when you're low on oxygen, we call that hypoxemia. So some of the signs of symptoms for hypoxemia is shortness of breath, increased breathing rate, increased heart rate, and paleness, and also cyanosis. Cyanosis is when our bodies start changing color into a more bluish tinge, either from the fingers or even from our fingers, feet, even our lips too. You can start changing color. So that's when you kind of know you're a little bit low on oxygen. You might feel a little bit lightheaded, some chest tightness, some pain, loss of coordination, a little bit more unstable on the feet, and then also maybe a short or even long-term memory loss as well. So if you ever are feeling these, then we might be a little bit low on oxygen. Next part is, how does it pertain to pulmonary fibrosis? So for most people here, the most common one that we've seen right now is the idiopathic pulmonary fibrosis. For people who are unfamiliar with it, it's a type of interstitial lung disease with an unknown cause of origin that causes changes around the air sacs or alveoli in their lungs. Now, with these changes, they do lead to permanent scarring, and with scarring, then we get an increased thickness of the alveoli. And that, unfortunately, impedes the oxygen-gas exchange from happening. Scar tissues also greatly affect how we breathe, and also such as breathing faster, shallower, and also making us, unfortunately, work a little bit much harder than compared to healthy people. Another thing that scar tissues can cause is cystic air spaces. Now, these cystic air spaces are air spaces in our lungs that unfortunately don't function very well anymore. They don't participate in gas exchange. So that's why sometimes you see people, even though they have good lungs or they have scarred lungs, some parts of it might not be working anymore. This is actually a very good picture of showcasing the different types, showcasing a lung that's that's healthy and a lung that is affected by pulmonary fibrosis. I'm just going to kind of zoom in on that and talk a little bit more about that. I'm just going to activate the pen laser pointer, actually. So hopefully you can see that. Okay, perfect. So the top part shows a healthy set of lungs. Over here, we have this little diagram kind of showcases the inside of the alveoli. This part here shows the thickness of the lung tissue, and the red part is our blood. So with a normal set of lungs, our alveoli, the walls of the alveoli are very thin. Here on the yellow, it has oxygen. Oxygen is able to pass through that quite easily, usually, and get into our blood. Carbon dioxide from the blood is able to pass through the opposite direction, and then we can breathe that out very easily. Fortunately, with pulmonary fibrosis, we have the scarring occurs, and that increases, the thickness of our lungs. So here on the bottom part is, we have a very thick layer of scarring, and also uneven too. And this, unfortunately, greatly impacts the way oxygen goes into the blood. Here, unfortunately, with the same amount of oxygen as compared to the normal one, only a small fraction of it is able to pass through. CO2 is generally not affected and is able to pass through to the lungs very easily. So generally, we don't see too much CO2 issues with pulmonary fibrosis. It's the oxygen part that is the biggest issue. Now, you're kind of wondering, how do we fix this, or how do we help with this? And the answer is adding oxygen in. By adding more oxygen to the lungs, a higher percentage of that is able to pass through and get into our blood. And this is kind of a little summary of that, just showcasing that with a normal alveoli, we have very thin walls. Oxygen is able to pass through very easily. And with fibrotic lungs, unfortunately, it's a lot bigger, and oxygen a little bit harder to pass through. Now, kind of wondering, most people, what we see now with pulmonary fibrosis is there's a big difference between sitting and moving. Usually, when we're sitting, we can breathe pretty well, generally speaking, but moving is usually the biggest problem. What we find is that when you're sitting, even with the impaired oxygen gas exchange, the lower amount of oxygen is still enough for the body to function properly. Just because when we're sitting, we're not using much muscles and not doing much, that is enough. As long as your oxygen saturation is above 90% and you're not feeling very symptomatic, then you may or may not need oxygen therapy, at least while you're sitting. Unfortunately, when you're moving, that's usually where the trouble begins. When we start using more muscles, our oxygen demand increases, and that's when we start seeing symptoms. Sometimes, usually, you are able to walk a fair amount of distance first before you start feeling symptoms or before the oxygen starts dropping. And then one of the big things that we notice is that when you're moving, your heart rate increases as well. And then because your heart rate increases, the amount of blood going to the lungs is a lot faster. And this also impacts how the oxygen gets into our blood. The less time the blood is in our lungs, the harder the oxygen is to actually get inside. So usually moving is very impacted. And if we see that our oxygen levels start dropping below 90%, then we should probably start looking into oxygen therapy at that point. So now that we know that if you do need oxygen, how do we get oxygen, at least in Manitoba? So there's a few ways to qualify, and a few different ways too. The first way, and the most popular way, is through the Manitoba Home Oxygen Program. You can also get oxygen privately as well if you don't meet any of these criteria. But generally, we always like to kind of go through the Manitoba program first. There is actually 4 ways you can qualify. The first way is by resting hypoxemia, or low oxygen while at rest. You can qualify for exertional oxygen when we're moving and desaturating, then we need oxygen. You can also qualify by if your oxygen level decreases at night, for nocturnal, and palliative as well. For pulmonary fibrosis, we generally look at the first 2, the resting hypoxemia and exertional. This picture on the side here is a referral form that hopefully most of your doctors are familiar with. They usually will fill this out and then send this away to the Manitoba Home Program to get started. So we'll first talk about the first method of qualifying for home oxygen, and that's with the resting hypoxemia. And that is done through a blood sample called the arterial blood gas, or ABG for short. Some of you may have got this done already by now, but what it is taking a small blood sample, usually about 1 to 2 milliliters of blood from the artery to measure the partial pressure of oxygen in your blood. They can take it in a few different locations, usually either the wrist for the radial artery or from the bicep tendon for the brachial artery. There is 2 other spots that we can, but we generally don't like to go that way. We can get it near the groin, the femoral artery, and also on the foot for the pedal artery. But generally, those are more in emergency situations. So we like to focus on the wrist first, and then if we need to, go to the brachial artery. This test is done on room air while you're sitting, and then depending on your numbers, if your PaO2 is less than 59 or less than that, then you will qualify for home oxygen. Unfortunately, we do have to repeat this test, usually about 1 to 3 months later, to see if you still need the oxygen. But after that, if your numbers are still below that, then you will qualify for long term, and you don't have to do another ABG for that purposes. Your doctor might still order an ABG done just to see your progress, but at least for funding-wise, that's about it. The second way that you can qualify for home oxygen is actually through exertion. And this is done by a blinded 6-minute walk test, or B6MWT for short. What we do is we want you to walk 2 times for 6 minutes using either with medical air or with oxygen, and kind of compare the differences. What we're looking for is to see if your oxygen saturation decreases, and then also if you can walk more with oxygen as well. We do want you to walk at your fastest speed possible, or fastest speed or most comfortable speed as you can. And you can also take breaks too. It's not, you don't have to walk the whole 6 minutes. You can take breaks, but we do time you for that whole duration. What we're looking for on the medical air is that if your oxygen level goes below 89% for at least 1 minute, and then compared to the oxygen, if you improve by 25%. Minimum, they are looking for about 30 meters. But generally speaking, when people walk with oxygen, we do see a bigger improvement in that. Another way is during the walk, we see your oxygen levels decrease too much, below 80% for 1 minute. Now, most therapists, when we perform these, if your oxygen level goes too low, we will stop you. We're not that mean. And we'll let you rest. But generally, if you go too low, we'll stop. And if we stop you, then you probably qualify for home oxygen. This test too allows us to determine how much oxygen you need as well. So when we do walk with the oxygen, we're going to be seeing how much oxygen to give you to keep your numbers up and for you to perform well. Unfortunately, we do have to do this twice as well. Another test 1 to 3 months later to see if things have changed and if you still need the oxygen. Now that you did qualify for home oxygen, what does the Manitoba Home Oxygen Program cover? So they do cover the stationary home oxygen concentrator. So you get a blue machine over there. They also cover emergency backup cylinder as well, just in case if something goes wrong with the home machine, at least you have a backup cylinder for those purposes. They'll cover the nasal prongs and tubings, so you're not worried about that. Maintenance of the machine and emergency services as well. So if something does go wrong, you don't have to worry. Just call the provider, and that way they'll come and help you. Now, unfortunately, under the Manitoba program, they do not cover oxygen cylinders or portable oxygen concentrators. So those would be out of pocket. However, there is other ways to get covered. And right now in Manitoba, most people who are using this type of system, you can use the Manitoba Pharmacare drug program to get it covered. So for people that aren't familiar with it, Manitoba Pharmacare is an income-based drug assistance program. They take your last 2 years of income and determine a deductible. Once you've met your deductible for medications, anything beyond that is Manitoba will cover. So they'll cover oxygen cylinders. It doesn't matter which type. And they also cover the portable oxygen concentrator as well, just the rental of the machines. Now, one of the downsides with pharmacare and with oxygen is that they don't allow direct billing. So usually you have to pay upfront first, and then in about 6 weeks, get reimbursed back from them. But once you hit your deductible, they will cover it. Another method to get oxygen is if you have private insurance. They tend to cover oxygen cylinders quite well, usually about 80 to 100%. And they do cover oxygen concentrators as well, but they mostly lean towards purchase. So it really depends on your plan, but always contact them to see what they'll cover for you. And these are tax deductible. So whatever you pay out of pocket that aren't getting reimbursed back, put in your income taxes as a medical expense. And so that way you can get some money back that way. So that's pretty much it. That's a very quick general overview of oxygen in Manitoba. Do you have any questions?
Do we have any questions?
We have one back there.
I will come over to you, Bruce.
Just two quick questions. I thought I just heard you say that rental costs under Manitoba Pharmacare are covered, but purchase costs are not. Is that correct? Did I hear that right?
That is correct, yeah. Unfortunately, Manitoba Pharmacare, they don't do purchase. They'll cover the rental of the machine.
Okay. The other question I have is, when you buy a tank, how long does it last? Does it die over time like your car does, or do they just keep going and going and going?
They'll last. Yeah, as long as you don't use it and it's turned off.
Okay. That's good.
Yeah, they will keep on. They'll just stay there forever. It will it'll depend on your oxygen flow rate. So once we kind of know how much oxygen you need, then we can kind of determine how long each tank lasts. So generally speaking, if someone that's on like a low amount of oxygen, like 2 liters per minute, the biggest tank, the E cylinder, will last about like 5.5 hours on 2 liters. And if you go smaller, a little bit less and less.
Okay, and that's a great answer. The question was like the mechanical device itself. Like, do they have to be replaced every 1, 2, 3, 4 years because they no longer work efficiently?
No. As long as you don't break it or drop it, they can last for a very long time. Once you kind of set the cylinders up, they have a regulator on top, and then as long as nothing happens to it, they can sit there for a very long time.
Okay. My last question, I know I only said 2, but what's the situation if there's an emergency? It's 2 o'clock in the morning and my machine's not working.
Mm-hmm. And that's why you have the emergency cylinder. So sometimes if you're having issues, if the machine stops working or power outage, and then we have emergency cylinder for you to use in the meantime. So give us a call after. Don't call us right away at 2 in the morning. There is someone that will pick up the phone, but switch over to emergency cylinder. Call us in the morning to let us know if the machine is broken or something's happened to it, and then we'll usually come out the same day to look after it. Yeah.
Explain to the group how big the emergency cylinders are.
I try to find. We have 2 different sizes. We have the most common one, the biggest one. It's about this big. So it's kind of like if you ever seen like welders, right? It's a little big tank like this. It's about my height, and they weigh about 150 pounds. We do have a smaller one that's like yay high. That one weighs about 100 pounds. So depending on the person's space and what's available at home, right? And what we can put in too, we'll see which one is better. I lean towards the bigger one. Bigger one, just more time, if we can.
And just to clarify for everybody, so if you put in the great big tank and say someone's on 6 liters, you would let them know how long that tank would last at 6 liters, correct?
Yep. So we usually have a little sheet that we put on top of it as well to kind of show you the breakdown of how long the tanks will last. Generally, we want, with the bigger one, on 6 liters, it should last about, I think, about almost 20 hours-ish. So yeah, so it should get you overnight, and then call us in the morning time, and then we can come out and see and fix what's the problem. Now, if the tank gets a little bit too low, right, we generally want to have at least about a minimum of about like 30-40%. Let us know, and we'll pop a new one in there just so that you have enough time in case a longer outage or something happens.
And every home that gets a concentrator gets a backup tank, is that correct?
Correct, yeah.
Another question comes to mind with respect to travel. What concentrators or tanks is recommended for doing airplane travel? What considerations need to be taken into account with the airlines? What procedures need to be followed so that you can take your concentrator wherever it is you're going?
So that's actually a very good question, because right now we have a lot of people are traveling with oxygen concentrators. It comes down to your flight and your airline. Each airline is a bit different, so always find out what your airline will allow you to take. They usually have an approved list of machines, and so just go from there. In terms of concentrator or cylinders, that's unfortunately a big debate right now. Right now, airliners prefer you to use these portable oxygen concentrators. They just feel a little more safe. Oxygen cylinders are very safe, but unfortunately, the airlines they rather not deal with them. There's a little more red tape involved when you're handling oxygen cylinders, so they always steer you towards more the oxygen concentrators. Now, with the oxygen concentrators, you have to see what the airline wants you to fill out. Some airlines require more paperwork than others, so look at their website, look at under their oxygen section, and see what you need to fill out. One thing is that once you have the machine, you also need to have enough battery time for the flight. So you need to have a minimum of 50% more flight time. So your flight, say you're going to Vancouver for about almost 3 hours, you need to have at least 4.5 hours of battery, just in case of emergency situations, delays, and stuff like that. So we have to figure out exactly what type of machine you need, how much oxygen you need, and how many batteries you need for the flight. It's a bit of a process, but it's just more planning. But we had a lot of people went to BC last year. We had a lot of people went to Mexico last year too. So it's very doable. Just takes a bit more planning.
My question is related to the threshold to qualify for oxygen concentrator. Could the argument be made that the threshold is too low and that you, by introducing it at an earlier time, you could make your muscles physiologically more efficient in oxygenation of the muscles so that you actually make your overall physiology better by introducing oxygen earlier in your exercise program?
So that is a very good question, actually, and it's hard to answer, at least in terms of funding. So ideally, if we see, and it is better to introduce oxygen earlier, that way you can perform better, exercise more, feel less symptomatic, and just feel easier to breathe. So all these is just who will pay for that, and that is kind of where it debates down to. In Manitoba, our criteria is having oxygen level that's 59, at least in the blood, 59 or less, and if you're walking, desaturating 89%. Compared to unfortunately, our neighbors, we are one of the easiest to qualify for oxygen. Our neighbors, unfortunately, their criteria is a lot more strict. But if you're okay if you don't qualify under the Manitoba program, you can always look into private oxygen, just paying for it out of pocket, and then go from there. Now, if you're paying for out of pocket and you are using pharmacare, you can actually start oxygen sooner. In regards to pharmacare, is they treat it as medication, and so you can pay for it privately and get reimbursed back by pharmacare. So that's kind of one of the ways you can start oxygen earlier, not through the Manitoba Home Oxygen Program.
It just seems to me probably one of the most fundamental things that we need. And the treatment is that hard.
Yeah, I know. And as we get older, I know we take breathing for granted, especially these younger kids now. But yeah, no, definitely, when you have a hard time to breathe, it's not a very good feeling.
In saying that, thank you for that great question, because CPFF is going to be talking to the Manitoba government about having POCs put in under the home oxygen program. We feel that they should be, because certainly people with pulmonary fibrosis, it takes a long time to qualify, because resting you're fine, and the criteria is a little bit too strict, and we like to see our people exercising more, but maintaining their oxygen. So CPFF is fighting on everybody's behalf for having better programs.
Oh yeah. I think Ken here has a question. Oh.
And so does Heidi as well.
The question I have is, home oxygen concentrators typically go up to 10 liters.
Mhm.
What do you do if your needs exceed that?
So we can, it's technically not recommended by manufacturers, but we can actually combine two of those machines together and create about almost 15 liters of oxygen. So people who do need more than 10 liters, we do have that avenue. It's not the greatest solution, because then now you have two machines. These machines they're running together, can be a bit more louder and produce a bit more heat, but we can if you need it.
Yeah, great, thanks.
I guess a little bit of a comment. Brad never qualified for home O2, but because I really felt as a nurse, physiologically it would benefit him, and also he felt improvement when he had the oxygen on. He used it quite a bit. Now, we paid for it out of pocket until we hit our deductible, and yes, then Manitoba Health took over. If I'm not mistaken, we paid $199 a month, $175 a month. I think it's gone up since then.
Yeah, it's about 195 now.
That's what I thought. But I know that it absolutely made a difference in how he felt. His oxygen would drop with exertion into the high 80s. And with the oxygen, we could keep that saturation up, and he felt better. And even at night sleeping, he slept better with the oxygen. So for us, it was something we talked about that was well worth the expense to give him that bit of oxygen that he required. In terms of the plane, interesting enough, we flew a couple years ago to Ottawa, and he has an Oxygo, which is the portable. I can't remember if it was WestJet or Air Canada, but we had to fill out medical forms that the doctor had to sign. And then their medical doctor had to approve. We had to have the papers before we got on the plane.
Yeah.
Yeah, so unfortunately, with right now the airlines, I know a lot of people fly with Air Canada. They are unfortunately one of the hardest to fly with oxygen. They have a fitness to fly form that's about 5 pages long that your doctor has to sign off of it. It includes your full physiology, your diagnosis, how much oxygen you need, and then from all that. So it's a bit more involved than other airlines. Right now WestJet has relaxed quite a bit. For my patients, I tend to recommend WestJet more. They used to have a form, but now you just more call their oxygen disability line. You tell them what flight you're on, which machine you're taking, and how many batteries you're taking to satisfy your flights. So it's a bit easier. Not saying that you might not run into any trouble, because whenever you do get to the plane, the flight attendants, they're not too familiar with these machines. So do give them a bit of a slack. But generally speaking, you do have to have all your paperwork ahead of time, and then it hopefully will go smoothly. Yeah.
I remember, just second to this, so the first time we went to Ottawa with the Oxygo, and we had to fill out all that paperwork. So the next time he decided to try without oxygen. Halfway through the flight, he was a bit in trouble, and he had to really concentrate on his breathing. So if we ever fly again, sorry, now he's got new lungs, so we don't have to worry about it. But it was interesting that without the oxygen, he actually did feel quite short of breath halfway through the flight.
And I was just going to say, once it's the beforehand preparation. I used to work for WestJet for 15 years, so it's the beforehand that takes a lot of work, getting the proper documentation from your doctor, making sure that's all filled out. Once you get to the airport, it's fine. The customer service agents just look to make sure it's been signed off. You can pre-board. The only thing that takes extra, if you have the concentrator, that's no problem. If you're traveling with the cylinders, they just have to be secured properly. So there's a way that the flight attendants secure it right in front of you. Usually you're traveling with 2 tanks. You have the backup one as well, so they'll secure the other one in the back in case you have to switch it on the flight. So that's the only thing. It does sound probably a little bit overwhelming, but once you get to the airport, it's really not. It's very streamlined. They look at the paperwork, signed, good, okay, you can pre-board, and that's it. So don't let it scare you.
So you may be wondering why you need more oxygen when you fly. Sometimes you will be borderline at home on the ground, but if the planes are not pressurized the same as we are here. So we did a lot of research last year, and like we breathed 21% oxygen here. When you're getting up in that plane in the max flying altitude, it's 15% oxygen. So that's why you will typically, if you're even borderline, whether you need oxygen or not, that's why you need the extra oxygen when you're on the plane.
Because they're pressurized only between 6,000 and 8,000. So that's why it's like if you're up for a big hike in the mountain, that would be the difference, right? So they're not pressurized to the altitude that we're used to.
Mm-hmm. Yeah, I kind of expand on that too. It's similar to if you ever like fly to somewhere that's high altitude, like Calgary, and you find that you're having a little hard time to breathe. That's pretty much the whole flight there. So generally, unfortunately, we can't test for in how you react on the plane. But general rule of thumb is we'll see how you are moving, and then kind of gauge from there to determine how much oxygen you need on the plane. But generally speaking, we do see about 4 or 5 point decrease from resting. So we can keep, if you're sitting at about 95% on the ground level, so you might go down to 90% on the plane. Now, some people, you might feel okay, or you might go a little bit lower. By having a little bit of extra oxygen on the plane, it usually helps quite a bit.
I just wanted to say, I was going to bring up that altitude thing. I had a rare opportunity recently to go for a flight on one of the medevac jets, the new ones that are going to be used here, and for a quick flight. And yeah, you get up to 38,000 feet, and boy, I was struggling on my concentrator. It was really ineffective. But they do have onboard oxygen, goes right up to, I forget what it is, 15 or quite high. So, but yeah, flying, you have to be careful. If these concentrators are great, but not good if you need higher volumes. They lose their effective. And tanks are, of course, you can go up higher. So
yeah, and then that's what we do tell our patients that when you're flying to kind of gauge how you feel. If you're feeling that you're a little bit short of breath, a little bit lightheaded, just bump it up. That little bit extra bit will help. And then if you're still feeling that, then just keep it going until you feel comfortable. And then when you come back down to the ground, just lower back to how your normal settings are, and then hopefully you'll feel fine. Oh.
I just also wanted to say there is usually on each aircraft between 6 and 8 cylinders of oxygen, and it's not unusual for people to require oxygen up there. So if you do find yourself, you get into a medical situation, you ask the flight attendant, all the flight attendants are trained to use it, they bring it out, they put it on low flow or high flow, there's 2 settings, and it's fine. So don't ever feel nervous about that either.
Just a question. Drug companies like OFEV and Profenadone provide support until you reach your deductible. Does Carico provide any similar type of support?
No, unfortunately not. In terms of support for pharmacare, we don't do anything like that. Now, if you are using those type of medications, they're very expensive. So hopefully, yeah, you would, once you reach your deductible from that medication, anything else will be covered by pharmacare. So that's what we mostly see is that once you hit, most people on those type of medications, you can honestly start oxygen anytime, either privately or through the medical program. You'll get reimbursed back.
Another way, if you, because the pharmacare starts April 1 to March 31st, and so April 1 starts at 0 again, and then you have to reach your deductible. If you have a hard time making the first couple payments until you reach your deductible, you can go through Manitoba Hydro and you can put 12 equal payments for that deductible on your Manitoba Hydro bill. And that way you don't have to come up with all the money right up front.
Do they charge interest for that?
That would be a good question.
I don't believe so.
You would hope not.
Yeah, and it's not actually advertised very well.
At all.
It's on the Manitoba Hydro website. But yeah, not a lot of people actually know about that. It's for them to assist in your pharmacare deductible. That way you don't have to pay it all even though it could be a small amount or it could be a large amount, right? You don't have to pay it all in one go. You can space it out very evenly throughout the year and just makes it a lot easier.
Don't make it payments, they shut your power off.
I think you've answered my question already, but I just want to confirm. So if you have a Manitoba Pharmacare deductible, it applies to all of your medical needs? In other words, I'm on now for OFEV.
Yeah.
It's all working very well. But if I go to oxygen and I'm going to have some more medical expense, does that go to the same deductible? Like there's only one deductible?
Correct.
Okay.
Manitoba Pharmacare treats the oxygen cylinders, the concentrators, and the portable oxygen concentrator as medication or drugs. So that's how they classify it. And that's how they classify it for the rental of the portable concentrators. And that's why they don't cover purchase. To them, purchasing it is not a drug. So it's a bit iffy that way. But generally speaking, oxygen will be covered by them.
Hi, so just, and with the oxygen, because Brad never qualified under the Manitoba program, what we did was realizing it was a benefit to him. It was, I think, either Dr. Homick or his family doctor who had to prescribe it for him because it's actually considered a drug. And with the expensive medications that you guys are on, we hit our deductible pretty quick.
Yeah, you definitely need a prescription. So we all know everything we want to know, ever want to know about oxygen? Oh, one more question.
You're talking about that emergency emergency tank, so it's obviously it's too big to move around, so you'll be having it stationary in one spot. Well, now if it's over there and I'm here, I either I have to go and stay the whole time right by it, or I'd have to have a very long cord. Is that what they do?
Yeah, so we try to find a comfortable spot that you can access yourself. So hopefully not too far away from wherever you'll be. Usually a central location in a closet that's easily accessible, and usually we'll hook up a long tubing to it so that if you do need to use it, you don't have to fiddle too much with it. Just grab the tubing, turn it on, and away you go. Especially in the dark too, if you're being a little bit anxious or panicky, just know that just remember where we put the tank or where you want us to put the tank, and go to that.
And make sure you have a flashlight, not a candle.
I was gonna say, both Brad and I have tripped over that 50-foot long cord many a time. He was fortunate enough to inherit an Oxygo. I know that to purchase them brand new are probably thousands of dollars, but his inherited one was an older one. Then the problem with it is he needed new, he had to buy a couple cylinders for it, which is a couple $100, and the battery only lasts a couple hours. Now, I think with the newer ones, the battery lasts like 10, 12, 15 hours.
Not to that long,
No.
but they do get, depending on your settings, most people who are starting out on oxygen, if you're able to get a low setting, right, around like maybe 2 or 3, you can get about 6 to 8.5 hours on them. So generally more should be enough for the whole day. And if you're needing more time, you can plug them in to the vehicle or to outlets and charge it as you use it. So that way you get more time that way. And if you're really out and don't have access to electrical plugs, you can also get extra batteries too for those situations. And then so if someone that's, especially who, we have a lot of people that go to day programs, they're out in doing activities for 6 to 8 hours, and then they still need to go back home or just do some shopping after, right? Having an extra battery for those situations might be better actually. But generally speaking, if you have access to plugs, these machines should last quite a bit of time.
On a bit of a funny note, when the people from Home Oxygen talked to me when I qualified, told me a couple of things I thought were humorous in a way. They told me I shouldn't use an electric shaver when you're on Home Oxygen because the spark could ignite a fire, and I guess you burn all your hair off. The good thing about that is you don't need a shaver anymore. But the other thing was even hand sanitizer could ignite. I don't know about that, but I guess there's one way to find out. Has anybody got some in their purse?
So with hand sanitizer is to see the alcohol vapors, right? You have to be a little more careful with that because any alcohol vapors, that ignites the oxygen, will make that combustion a lot harder, a lot brighter. So then we run into situations. So we do want to avoid oils with oxygen. Oils and oxygen, unfortunately, they don't work very well. That can cause a spontaneous combustion to occur. So if anything, always try to use water-based stuff. So water-based moisturizers, water-based hairsprays, shavers and stuff like that too. So we do have to change some of the things, to products we use, but there'll always be a safe alternative.
Very fortunate that my husband likes to cook. Now, when he's not on oxygen yet, but we see it's coming. Will he be able to cook? Like, I mean, is there danger, like what we're talking about with your oils and, a stove and things like that?
My cooking is dangerous.
So it depends on how good your wok skills are, but cooking wise, no, very safe. Especially if you're using electric stoves, all right, then we don't have a chance of open flames that can ignite it. Generally speaking, when people are cooking, we do recommend you tuck the oxygen tubing underneath your shirt so that it doesn't flop over. And that's kind of the biggest risk we find is that when you're cooking, you're really engaged, right? Sometimes the tubing might just go over the stovetop and touch the burner, and then we have a fire. Or if you're leaning down to get something from the oven, leaning down and then it touches that. So generally speaking, you always want to just tuck it underneath the shirt and when you're cooking. As long as you do that, you'll be fine.
Do we have any more questions, or has Simon answered absolutely every question he can on oxygen today? All right. So Simon, on behalf of the whole group today, thank you so much for an excellent presentation and for all the questions that you were able to answer for our group. And thank you.
Thanks for having me.